Good evening, everyone. Our session will begin shortly. Join with us, and we appreciate your patience. Hello, everyone. We will be starting our session in a minute. Thank you for joining. So, good evening and a very warm welcome to everyone gathered here on this meaningful occasion, World Stroke Day 2025. Every year on October 29th, we come together to raise awareness about stroke, a condition that can change lives in an instant, yet one that is largely preventable and treatable with timely action. Today's theme, Every Minute Counts, reminds us how precious each moment is when it comes to saving a brain and a life. Today, we remember those who lost their lives to stroke and honor the remarkable strength of the survivors who continue to inspire us with their courage and determination. On behalf of VIAMS, Dr. Vijit KV and team, I extend my heartfelt welcome to all patients, caregivers, doctors, therapists, and well-wishers joining us today. Along with Dr. Vijit, we have Dr. Neetu S. Jit, Medical Superintendent and Director and Parkinson's Disease Expert at VIAMS, Dr. Aditya Tangappan, Residential Medical Officer VIAMS, Dr. Prasad AP, Senior Physiotherapist, and Mrs. Dilna, Audiologist and Speech Language Pathologist, to conduct sessions. We have a series of insightful sessions that will explore how Ayurveda and modern rehabilitation come together to restore hope and function after a stroke. I invite all participants to listen with intent, learn with curiosity, and take part wholeheartedly in today's webinar because every shared insight brings us closer to saving lives and spreading awareness. We encourage all to stay engaged throughout the session, post your questions in the chat box, and share your reflections. It's my honor to introduce our keynote speaker, Dr. Vijit KV, Managing Director and Chief Physician of VIAMS, a leading Ayurveda expert with over a decade of research and clinical experience in neurodegenerative and neurorehabilitative medicine, expertise in managing chronic diseases through Ayurveda and lifestyle therapy, committed to patient safety and improved healthcare outcomes. He will deliver the keynote address on understanding stroke, its types and early signs, Pakshaghada, the Ayurvedic perspective of stroke, prevention of stroke, and rehabilitation. It's my pleasure to invite Dr. Vijit to deliver the keynote address and share his expert insights with us. Over to you, sir.
Good evening, one and all who joined us today in the World Stroke Day 2025. Thank you, Dr. Prasida, for the wonderful introduction. So, let's begin by understanding what a stroke truly is. A stroke occurs when the blood supply to a part of the brain is suddenly interrupted, either due to blockage of an artery, that is known as ischemic stroke, or a rupture of a vessel causing bleeding, that is hemorrhagic stroke. So what we can understand from this statement is this stroke is mainly two types, that is ischemic stroke and hemorrhagic stroke. When this happens, brain cells are deprived of oxygen and nutrients and they begin to die within minutes. That is why we say time is brain. The effect of a stroke depends on which part of the brain is affected. Some people may lose the ability to move one side of the body. Others may lose speech, memory, or balance. But behind every clinical term lies a human story, a life changed in seconds, a family shaken, a future uncertain. Yes, the message we share today is one of hope and possibility. With early recognition, emergency medical care, and integrative rehabilitation combining Ayurveda, physiotherapy, speech therapy, psychological support, recovery is possible. In Ayurveda, we understand the brain is a seat of consciousness, the Shira, the Marma system, where Vada governs movement and coordination. When Vada is disturbed, as in Pakshagata, function is lost. Thus, stroke management is not only but restoring blood flow, but also about restoring balance, energy flow, and inner healing. So today, as we mark World Stroke Day, let's remember a stroke is a brain attack, urgent, critical, and yet with timely care and integrated healing, lives can be transformed. So, once we understand what stroke is, the next crucial step is recognition. So every minute after stroke matters. In those moments, nearly 2 million brain cells can die each minute if the blood flow is not restored. That's why the global awareness slogan says recognize early, act fast. The easiest way to remember stroke symptoms is through the acronym BEFAST, BEFAST. Let's see what it is. So, B for balance. A person may suddenly lose coordination or feel dizzy. That is the balance. And E for eyes, blurred or double vision, or sudden loss of sight in one eye. F for face. Ask the person to smile. One side of the face may droop. A for arm. Ask them to raise both hands. One may drift down. S for speech. They may slur words or struggle to speak or understand. And T for time. This is the most vital step. Don't wait. Call emergency services immediately. In India, many precious hours are lost due to hesitation or lack of awareness. Stroke is not a condition to wait and see. Acting fast can save the brain, preserve ability, and protect life. From an Ayurvedic lens, we could say Vega avarode roga bhavanti. When natural flow is obstructed, disease occurs. Similarly, when the brain's flow is blocked, urgency and timely action restore balance. As we observe World Stroke Day, let us pledge to recognize the signs, act without delay, and spread awareness. Because truly, every minute counts. Save a brain, save a life. Now, the importance of golden hour. The term golden hour refers to the first 60 minutes after the onset of stroke symptoms, the most crucial window to save brain tissue and preserve function. During a stroke, blood supply to part of the brain is cut off. Without oxygen, 2 million brain cells can die every minute. That's why neurologist says time is brain. If the patient receives medical attention within this window, that means within 60 minutes of the stroke, through emergency thrombolytic therapy in ischemic stroke, or pressure control and bleeding management in hemorrhagic stroke, the chance of recovery increases dramatically and disability can be significantly reduced. Unfortunately, in many parts of our country, this golden window is often lost due to delay in recognition, hesitation, or lack of awareness. This is why public education is so vital to teach everyone the signs of stroke, that is BEFAST, and the urgency of calling emergency help immediately. From an Ayurvedic perspective, this aligns the principle of Kalameva Vaidhyam. The timely intervention itself is the greatest medicine. So Ayurveda reminds us that the sooner balance is restored, the deeper the healing. So the golden hour is not just a medical term. It is a moment of destiny when irreversible loss and hopeful recovery. So our mission in this World Stroke Day is to ensure no moment is wasted, that every patient, every family, and every caregiver recognizes the signs and acts fast. Because in stroke care, each minute is not just time, it is life, memory, and movement. Now, let's discuss the Ayurvedic perspective of stroke. From an Ayurvedic point of view, what modern medicine calls a stroke closely resembles the condition described as pakshagata or pakshabada, that is, the meaning paralysis of one side of the body. So, Ayurveda classifies this under Vata Vyadhi, that is, disorders arising from imbalance or dearrangement of Vata dosha, the biological energy responsible for movement, nerve impulses, and coordination. When Vata dosha becomes aggravated due to factors like aging, stress, irregular lifestyle, improper diet, trauma, or blocked channels, it can lead to sudden dysfunction in the brain and nervous system. So, in the samprapti or pathogenesis of this pakshagada or the stroke, several stages unfold. First, there is Vada Prakopa, that is the aggravation of Vada. Then the avarana or the obstruction occurs when Vada is blocked by a couple of doshas, that is the Kapha or Pitta. So this will lead to Srodoroda, that is the obstruction of vital channels that carry nutrition and energy. Over time, Dhadukshaya means tissue depletion follows, resulting in weakness and paralysis. So, this Pakshakara is not merely physical immobility, it represents deeper disruption of the body's internal harmony, energy flow, and neural communication. So, the treatment focuses on restoring balance and reactivating flow. Therapies such as Snehana, that is the oleation, Svedana, that is the fermentation, and Basti, medicated enema, Nasya, nasal therapy, and Rasayana, regeneration, form the foundation of care. These help reduces stiffness, nourishes the nervous system, improve circulation, and promote recovery of functions. So, when combined with modern physiotherapy, speech therapy, and rehabilitative care, Ayurveda amplifies recovery by rejuvenating both body and mind. So, in essence, Ayurveda doesn't just treat Pakshagara, it helps the person regain balance, purpose, and confidence. So, this is the philosophy. This is the philosophy of integration that VIAMS champions, where the ancient science of healing walks hand in hand with modern medicine, offering hope for every stroke survivor. So, when we talk about the stroke, it is easy to focus on emergency care and rehabilitation. But the greatest victory over stroke lies in prevention. Modern research shows that nearly 80% of strokes are preventable simply by controlling non risk factors such as high blood pressure, diabetes, cholesterol, obesity, smoking, and inactivity. Yet the awareness and discipline are often what stand between risk and recovery. So, in Ayurveda, this principle is deeply rooted in Nidhana Parivarjana, that is, avoiding the root cause itself. Ayurveda reminds us that disease does not begin overnight. It begins with small imbalances in routine, diet, and thought. When these accumulate, Vata, Pitta, and Kapha, the three doshas, become disturbed, leading to disorders like Pakshagara. So, prevention begins with awareness and balance. Eat fresh, wholesome, and light food by avoiding excess salt, fried items, and stress eating. Maintain dinacharya, that is the daily regimen, and ritucharya, the seasonal discipline, to keep the doshas in check. Practice yoga, pranayama, and meditation to reduce stress, one of the silent triggers of stroke. Sleep well, move daily, hydrate adequately, and monitor your blood pressure regularly. Modern and Ayurvedic wisdom both remind us a calm mind, balanced body, and disciplined lifestyle are the best medicines for preventing stroke. As we observe World Stroke Day, let's pledge not only to treat stroke but to prevent it through awareness, lifestyle harmony, and timely care. Because truly, prevention is the purest form of cure and the most compassionate act of medicine. When a human suffers a stroke, the real challenge begins after the hospital discharge. It is not just a medical recovery, it's a journey of rediscovering self, hope, and strength. The first days are often filled with fear and uncertainty. Patients may lose confidence, caregivers may feel overwhelmed, and every small task can seem impossible. But step by step, with compassionate care and consistent rehabilitation, transformation begins. At VIAMS, our approach to rehabilitation is not limited to physical therapy. We integrate healing systems of Ayurveda, physiotherapy, speech and language therapy, yoga, counseling, nutrition, occupational therapy, creating a circle of recovery that touches every dimension of human life. And one more thing is caregivers care. So Ayurveda nurtures the nervous system and restores balance through therapies like Apyanga, Vasti, and Rasana and Panchakarma. Physiotherapy rebuilds the mobility and strength. ASLP therapy revives speech, swallowing, and communication. Yoga and pranayama calm the mind and enhance neuroplasticity, which is very important in stroke rehabilitation. Counseling and mindfulness restore confidence, reduce depression, and strengthen relationships. Dietetics ensure that brain and body are nourished for regeneration. The role of caregivers cannot be overstated. Their patience, love, and encouragement become the medicine that no doctors can prescribe. They are the unseen pillars of rehabilitation. In Ayurveda, there is a beautiful concept. Shariram sadhanam dharmasya. The body is the instrument through which we fulfill the purpose of life. Therefore, restoring function is not merely about movement. It is about restoring purpose, dignity, and joy. Every stroke survivor journey is a story of resilience. Today, on World Stroke Day, let us honor not only the science of recovery, but the spirit of the hope that makes the healing possible. Because when medicine and compassion walk together, miracles happen every day. This is the most important part of my session. So many people think that stroke is a one-time event. But in reality, for some individuals, it marks the beginning of a longer journey of neurodegeneration. After a stroke, the areas of the brain responsible for coordination and cognition may be damaged or deprived of oxygen. So, when this damage affects the deep structures like the basal ganglia, patients may later develop vascular Parkinsonism, where symptoms like slowness, rigidity, and balance difficulties appear, resembling Parkinson's disease, but arising from poor vascular supply rather than dopamine loss alone. Similarly, when the brain's memory and thinking centers are repeatedly affected by small or silent stroke, it leads to vascular dementia, a progressive decline in cognitive function that deeply affects daily living and family relationships. This is why early rehabilitation is not optional, it is essential. An integrated approach combining Ayurveda Panchakarma therapies, Ayurveda customized medicines, neuro nourishing formulations, physiotherapy, yoga, ASLP, dietetics, and psychology counseling can help restore circulation, reduce inflammation, and promote neuronal recovery. So, our message today on this World Stroke Day is that stroke care doesn't end with survival. It continues with comprehensive neuro-rehabilitation. Recognize early, act fast, and restore life. Because every step we take today prevents a much deeper neurological decline tomorrow. So before we move to next session, I would like to leave everyone with one thought. Healing the brain is not only a medical act, it's a sacred journey of restoring balance, purpose, and rhythm of life. Stroke changes the body, but it doesn't have defined the person. At VIAMS, we have learned that recovery is not just about movement or speech. It's about rebuilding the individual from within. It's part where science meets spirituality, where medicines meet mindfulness, and where the patient becomes the center of care. As we continue this journey, we will now move into the next important session led by Dr. Needu S. our senior consultant at VIAMS. So she will take us through the VIAMS Stroke Integrated Rehabilitation Protocol, a structured, personalized, and phased approach that integrates Ayurveda with physiotherapy, speech therapy, dietetics, and yoga. So let's open our minds and hearts to understand how holistic system of care can transform not just treatment outcomes, but the quality of life itself. Thank you.
Thank you, Dr. Vijit, for that enlightening address that beautifully connected medical science with Ayurvedic wisdom. So please post your questions or doubts in the chat box so we can address them in the Q&A session. Next, we move to a detailed session on integrated Ayurveda approach in stroke rehabilitation by Dr. Neetu. Dr. Neetu S. Jit is an Ayurveda physician specializing in the integrative management of Parkinson's disease and dementia, with a special focus on women's neurological health. At VIAMS, she leads the neurorehabilitation and caregiver support unit, combining Ayurvedic Panchakarma, physiotherapy, speech therapy, and psychological care to restore function and quality of life. Her compassionate approach bridges science and sensitivity, guiding families through every stage of healing. Over to you, ma'am.
Namaste, everyone, and a heartfelt thank you to Dr. Prasita for that warm introduction. Today, I will be sharing the VIAMS approach in stroke rehabilitation, and together we will explore how Ayurveda, when integrated with modern care, can beautifully support recovery, restoring movement, balance, and vitality. Let's begin. At VIAMS, we believe every stroke survivor is unique. No two people experience a stroke or recover from it in the same way. And that's why our care is always personalized. We design each plan according to the person's prakriti, that is natural constitution, and their current stage of recovery, whether it's acute, subacute, or chronic. Each plan includes customized medicines, supportive therapies, and simple lifestyle guidance. Our rehabilitation moves through three key phases. We start with Purva Karma, preparing the body, then move to Pradhana Karma, the core treatment phase, and finally complete with Rasayana, the rejuvenation stage. This phased, individualized process allows healing to unfold gently, safely, and holistically. The first stage is Purva Karma. Before we begin deeper therapies, we first make the body receptive. We start with Rukshana, using dry techniques like Udvartana, a herbal powder scrub that lightens the body and boosts circulation. Next comes Snehana, that means oleation, which includes both internal and external methods. Internally, we use medicated ghee or oils, and externally, we perform Abhyanga that nourishes the tissues and calms aggravated vata. After that, we move on to Svetana, that is steam therapy, which help open the srodhas. Srodhas means the body's subtle channels. We often combine this with different kinds of kiddies to ease stiffness and flush out toxins. Together, these steps gently prepare the body, setting the perfect foundation for deeper and more effective healing. Once the body is ready, we move into Pradhana Karma, that is the main therapeutic phase. Here, our primary goal is to bring Vata dosha back into harmony, since Vata governs all movement and nerve activity. The most important therapy in this stage is Vasti, that is medicated enema, which is considered the ultimate treatment for balancing Vata. It helps restore motor and sensory coordination, supporting both physical and neurological recovery. When required, we also perform Virejana, that is purgation therapy, that helps clear accumulated toxins and promotes systemic balance. Then Nasya or nasal therapy, that plays a key role in supporting speech and cognitive recovery by directly nourishing the brain and nervous system. And based on the patient's strength and condition, we may also include treatments such as Shirodhara, Shirovasti, Talam, Piju, or Shiradhoma, each carefully selected to calm the nervous system and enhance recovery. So every step is chosen mindfully, keeping the patient's comfort, readiness, and overall well-being at the center of care. The third stage is Rasayana, that is rejuvenation. And this is truly one of the most beautiful part of the recovery journey. After cleansing and balancing, the body needs nourishment and rebuilding both physically and mentally. Here, VIAMS focus on restoring vitality, memory, and strength through Rasayana herbs, tonics, and diet. We recommend warm, easy to digest meals to rebuild ojas. Ojas means our life essence and immunity. This is the stage where the patient regains confidence, positivity, and inner balance. At VIAMS, integration is truly our strength. We work together with modern rehabilitation teams to provide complete care. For example, Abhyanga sessions are timed before physiotherapy to prepare muscles. Nasya supports speech therapy, enhancing cognitive recovery. Yoga and pranayama improve posture, breathing, and emotional steadiness. And our Ayurvedic diet aligns with modern nutrition for balanced nourishment. And counseling blends with occupational therapy to restore independence and confidence. This combination of ancient wisdom and modern science creates a 360-degree healing environment addressing body, mind, spirit together. Let's take a moment to look at the key goals of stroke rehabilitation. First and foremost, our main aim is to restore function and independence, helping patients relearn vital skills like movement, speech, and coordination. Secondly, we work to improve overall quality of life, not just physical recovery, but also emotional and social well-being, so that the patient feel whole again. Next, we help them relearn everyday skills, simple yet powerful activities like eating, dressing, or walking, which slowly rebuild confidence and self-reliance. We also focus on supporting cognition and emotions through memory exercises, mental stimulation, and compassionate counseling that address the emotional impact of stroke. And finally, a very important goal is preventing future strokes. We guide patients in adopting healthier lifestyle habits and balanced diet to support long-term wellness. So, in the end, Stroke rehabilitation is not just about surviving, it's truly about living again with dignity, confidence, and hope. Now, I would like to talk about a very special part of recovery, ones that often overlooked, and that is caring of the caregivers. Behind every recovering patient, there is always someone standing quietly in the background, offering endless patience, strength, and love every single day. And at VIAMS, we truly believe that they deserve care and attention too. That's why we make it a point to support our caregivers just as much as our patients. We provide emotional counseling to help ease their stress and prevent burnout. We offer hands on training so they feel confident and capable while supporting their loved one at home. And we organize group sessions where caregivers can connect, share their stories, and find comfort in knowing they are not alone on this journey. Because when caregivers feel supported, patients feel better. I would like to leave you with this thought. Recovery is not just about movement, it's about restoring rhythm, dignity, and hope. Ayurveda reminds us the true healing unites the body, mind, and spirit. When Ayurveda blends with modern science, recovery becomes not just possible but meaningful and lasting. Thank you all for your kind attention and commitment to holistic healing. Namaste.
Thank you, Dr. Neetu, for your insightful presentation on VIAMS approach on stroke rehabilitation. Please post your questions or doubts in the chat box so we can address them in the Q&A session. Now, we will hear from Dr. Prasad AP, our senior physiotherapist, who will discuss the rehabilitative aspects and the vital role of physiotherapy in stroke recovery. With over 15 years of clinical experience, Dr. Prasad AP is a seasoned expert in neurorehabilitation and spine and joint rehabilitation. His evidence-based and patient-centered approach has helped countless individuals regain mobility, strength, and independence through integrative physiotherapy and rehabilitation protocols at VIAMS. Over to you, sir.
Good evening, everyone. Am I audible?
Yes.
Okay. My name is Dr. Prasad, physiotherapist at VIAMS. And thank you, Dr. Vijit and team VIAMS for giving me this opportunity on this World Stroke Day to talk about the role of physiotherapy in stroke rehabilitation. And as you all know, physiotherapy is an inevitable part of stroke rehabilitation. And it helps the stroke patients to regain their mobility, strength, and independence lost due to the brain damage. And it also helps in the neuroplasticity. Neuroplasticity is nothing but the ability of the neural mechanism of the brain to repair itself. Okay, so physiotherapy teaches new and existing neural pathways to take over the lost functions, promoting their recovery. Next slide, please. You all know that physiotherapy begins as early as possible after a stroke attack. In hospital stays, it starts after 24 to 48 hours after a stroke, once the patient is vitally stable. And after that, an individual treatment plan is developed based on their impairments, and we start the physiotherapy session. Some may require like chest physiotherapy if they are admitted in later, and some may require early bed mobilization to prevent the complications like bed sores and all. So it depends upon their individualized treatment plan. And in disciplinary collaboration, we physiotherapists actually we work with a number of specialists and we collaborate the treatment like with Ayurveda practitioners, occupational therapists, and these speech therapists for the fullest recovery of the patient. I mean, the rehabilitation of the patients. And it creates this teamwork, creates an comprehensive treatment plans for stroke recovery. And this addresses all aspects of patients' physical, cognitive, and emotional needs also. And the key role of physiotherapist and stroke rehabilitation. These are the key roles. Like first one is the mobility. We have to regain their mobility as soon as possible. And once they regain their mobility, then we have to start gait training. That's gait training is nothing but the way they walk. That we have to emphasize. Then comes the strengthening of the muscles. Like individually, all the muscle we have to strengthen. Then comes the balance training. So in mobility, I'll go just a little bit about the mobility and gait training. Mobility involves that I mean, after a stroke attack, the patients they become paralyzed, as you all know. Either one side or entire the limbs will get paralyzed. So this mobility involves relearning and practicing the functional movements like rolling over, moving from bed to a chair, and transferring from a wheelchair. And also, we have to emphasize this mobility first. Then comes once the patients become mobile, then comes the gait training. Gait training is essential for restoring the walking ability after stroke, and thus improves walking patterns, speed, and balance. So we use assistive devices like walker, canes, and all for gait training. And now we also have advanced techniques like robotic gait therapy and all, where we use body weighted, supported treadmills and all for this type of gait training. Then comes the strengthening and balance training. So often this stroke weakens the muscles of one side of the body or the entire body and all. Like if the patient is quadriparesis, their entire body, I mean all the limbs will get paralyzed. So in that case also we have to strengthen those muscles. So we use different types of weights, bands, and resistant bands to strengthen these muscles. By building the strength and endurance in the affected limbs, then they can walk. Like they can walk the gait training, they can do the weight training. Then many of the stroke victims, I mean stroke survivors, they experience the balance problem also, which increases their risk of falls. So we induce this static and dynamic type of balancing exercises to improve their balance and stability also. Next slide, please. Thank you. Then comes the range of motion exercises. Range of motion exercise is nothing but they lose their range of motion in the joints after a stroke attack. So we have to passively do the range of motion exercises to prevent their muscle stiffness, contractures, and all. So then only the blood circulation will be there. Otherwise, the joint will go for stiffness, contracture, and the muscle will go for disuse atrophy. So in order to prevent that, we need to start the range of motion exercises as soon as possible. Then comes the constraint induced movement therapy. It is a technique which involves restricting the use of the unaffected limb to force the patient to use their affected limb. So it is used to improve the motor function and has proven effective for chronic stroke patients. Okay. Then comes the functional electrical stimulation. These are all advanced physiotherapy techniques, actually. This functional electrical stimulation, then aquatic therapy, and all are all advanced physiotherapy techniques. This functional electrical stimulation is used to activate the nerves and to stimulate the muscles. So we give mild electrical stimulations with the help of some machines that have, machines to that particular muscles which are weak. this will activate those nerves and muscles. So and muscles that have been weakened for or paralyzed by the stroke. Then comes this, as I said before, aquatic therapy and mirror therapy. This aquatic therapy is also called hydrotherapy, where we use buoyancy of the water. I mean, exercises performed in water. This take the advantage of buoyancy, that is to float in the water. So the patient won't feel that weight. So it will be easier for them to move. So we use this aquatic therapy. This is an advanced physiotherapy technique. Then comes the mirror therapy. By watching the reflection of the unaffected limb in the mirror, the brain can stimulate to promote the movement in the affected limb also. This is mirror therapy. Next comes, after all doing this, what are the benefits of therapy? So after all these things, mobility exercises, gait training, then range of motion exercises and all, then comes the benefits of physiotherapy. The first one is, this physiotherapy enhances the mobility and independence. By helping patients regain movement and control, physiotherapy increases their independence in performing their activities of daily life. Okay, then comes the reduces the risk of fall. By doing physiotherapy, they get balance, right? So balance and gait training significantly improve a patient's stability, and thus lowering the risk of dangerous fall. Through physiotherapy we can manage pain and spasticity also. So physiotherapy techniques can alleviate pain and reduce muscle stiffness and involuntary spasms, that is spasticity, that are common after a stroke. By doing physiotherapy, it boosts their mental well-being also. So making progress in physical abilities can significantly improve a patient's mood, motivation, and or overall confidence, helping to combat feeling of frustration and depression. Then comes physiotherapy. Through physiotherapy, we can prevent secondary complications. Like early and consistent physiotherapy helps to prevent issues caused by immobility, such as muscular atrophy, joint problems, and this bed sore and all. Then continuum of care. The timeline of physiotherapy often continues for months or even years, as recovery can be a long-term process. As we all know, some patients may recover fast, some patients may take long term. It depends upon their stroke in the brain, how much brain damage occurred during that stroke. Okay, then comes hospital and the acute phase. So we start, as I said, rehabilitation starts from 24 to 48 hours after the patients became medically stable. So rehabilitation often begins in the hospital as soon as the patient is medically stable. The focus is on preventing complications and early mobilization. Then comes the outpatient and home-based therapy. Okay, after hospital's discharge, therapy continues at an outpatient clinic or through home-based programs. So even caregivers and family members are also trained to assist with exercises. Then long-term support. So for many stroke survivors, maintaining physical health through ongoing exercises and activity is a lifelong effort. Physiotherapists can provide guidance for long-term fitness and lifestyle adjustments also. Next slide, please. So physiotherapy is not just about restoring movement, it's about restoring dignity, independence, and hope. So every step a patient takes is a triumph of resilience, reminding us that healing begins the moment we believe recovery is possible. Thank you.
Thank you, Dr. Prasad. Your valuable insights have greatly enhanced our understanding of physiotherapy's role in stroke rehabilitation. So please post your questions or doubts in the chat box so that we can discuss it at the end of the session. Next, we have Mrs. Dilna, our audiologist and speech language pathologist, who will share her insights on speech and swallowing rehabilitation after stroke. ASLP focused on the assessment and rehabilitation of speech, language, voice, and swallowing disorders. In neurorehabilitation, ASLP plays a vital role in helping patients regain communication skills and safe swallowing functions after conditions like stroke, Parkinson's disease, or dementia, restoring confidence, connection, and quality of life. Over to you, ma'am.
Thank you, Team VIAMS, for giving me an opportunity. So let's move. First of all, I'll tell who is a speech language pathologist. So, speech language pathologist is a professional who helps with a patient who is having problems with speech, language, voice, and swallowing. Swallowing means a patient who is having difficulty to eat or drink. And whereas in voice, the voice like monotonous voice, hypertonic voice, pubophonia, in those conditions, and speech language pathologist help to regain. And also the main focus of a speech language pathologist is also in communication. Sir, the next slide, please. Where the speech disorder, in speech disorder, we can see mainly the articulation problems, where the sounds are pronounced like mistakenly, and also fluency problems can be seen in speech disorders. Whereas in language disorder, an individual will be having difficulty with understanding and also with expressing what he or she should have to tell. Here the expressing means what they are speaking or telling. And in voice disorders, as I have told before, and also in social communication issues, that will tell pragmatic skills, which is affected. The pragmatic skills will be affected in social communication issues, where an individual will be having difficulty with greetings, conversations, like that. Sir, next slide. The main problems that has been seen after a patient with stroke is the patient will be having difficulty with speaking, understanding, swallowing, and also with communication problems. According to speech language pathology, or in according to the speech aspects, the main thing that is seen after a stroke patient is conditions like aphasia, dysarthria, apraxia of speech, cognitive communication disorders, dysphagia. Sir, you can move the slide. Okay. Where aphasia means an individual who has overcome with stroke is having difficulty with speaking, understanding, reading, or writing. The therapist will help with relearning the language skills through a structured practice. And also, we will be using so much of tools like AAC, augmentative and alternative communication, then picture boards, and also the communications are not only through speaking or not only through speech. It can be also through gestures. It can be also through sign languages. So an speech language pathologist will help in those manners for a patient with aphasic conditions. Then here comes dysarthria. Dysarthria, where in dysarthria, the patient will be having a slurred or slow speech. This is due to the weakness of the muscles that is being used for the speech. The vocal cord or larynx that is giving us the sound is the muscles will be having difficulty. So due to this problem, we can see dysarthric conditions in patients. So for dysarthria conditions, a therapist will help help with breathing exercises, and also they'll be helping with the patient to uh, control their volume, their pace, and also the clarity of speech, but by techniques called pacing or tapping techniques, like that. Then the next come apraxia of speech. Here, the apraxia of speech is speech means it is difficult to coordinate the muscle that is used for speaking, which will result in limited speech ability. Here, apraxia means the patient will be knowing everything. I'll give you an example. Apraxia is a condition where if we give an apple, they won't be able to tell this is an apple. But randomly they can tell, okay, give me the apple. Randomly they'll tell. But if we are giving the command, the patient won't be, if we are asking them what is this, they won't be able to tell this is apple. The condition of planning and coordinating with the mouth movements is happening with apraxia of speech condition. Okay, for this, we'll be helping with sequencing of sounds, and also we'll be giving them the repeated practice of repeated practice. Then we'll be working on patients with apraxia. Then the next come cognitive communication disorder. Here, the main problem is with attention, memory, organization, and also with problem solving. So here, the therapist will help with some attention activities, and also memory games, like common memory games like Sudoku, and also like puzzles. We'll be helping with puzzles, and we'll be helping with some memory games, like we'll be keeping every of the things, then we'll be just taking it off, then we'll be asking which all things I have kept. It is very normal, as we all know, like memory games will be giving, and some attention activities like uh, beats, doing the beats. Those things will be given in cognitive communication disorders with patients with stroke. Then also this alexia and agraphia is coming under aphasia itself. Alexia is the difficulty to recognize the words, or the difficulty to read. That is called the alexia, and agraphia means difficulty writing. That is called the agraphia. So in this, the therapist will help to relearn the letters, or they'll be reteaching the letters, and also recognition of words, and also therapist will practice on typing tasks, writing, and all. It will be in a structured manner. Then the next come dysphagia. Dysphagia means the patient will be having difficulty with swallowing the liquids or the solids. Dysphagia is caused because of the damage to the brain region that is controlled the complex coordination of muscle which is needed for swallowing. So that is the problem for that is what is leading a stroke patient to dysphagia. So here we'll be doing a test called VFSS, video fluoroscopy. From that we can come to know that if the patient is having any difficulty, like any silent aspiration is happening or not. So after that test we will be starting with dysphagia therapy, so that we'll be giving them some exercises or techniques like manuals technique, then shakers exercises, and also we'll be focusing on the pharyngeal part of the patient, and we'll be improving the muscles, and we'll be working on the dysphagia part of the patient who has dysphagia after stroke. The main thing is that the patient should be okay. Thank you.
No, you can continue. I think it's on the next slide. Please continue.
So, the patient can be recovered very early. Is like if there is a condition called neuroplasticity, which is the ability of the brain to reorganize its function and structure. So, as soon as we give the attention, we can bring the patient to the normal range. Okay, thank you.
Thank you, Mrs. Dilna, for your enlightening presentation and for sharing your valuable insights on the role of speech therapy in stroke rehabilitation. Now, let me hand over the session to Dr. Aditya Tangappan, Residential Medical Officer at VIAMS, who will guide us through the question and answer session.
As we come to the close of this enlightening session on World Stroke Day, I want to take a moment to express my heartfelt thanks to our speakers for their valuable insights, data, and inspiration in helping us better understand stroke prevention, management, and recovery. Your dedication to raising awareness and improving patient outcomes truly makes a difference. Now, we would like to open the floor for questions and discussion. This is your chance to engage directly with our experts and explore the topics that stood out to you. Please don't hesitate to ask. Every question adds value to the conversation. If you have a question, please type it in the chat box or use the raise hand feature and we will make sure it's addressed.
I think the participants can unmute themselves and ask the questions.
If you would like to share your experience briefly, please go ahead.
We're getting so many messages. Somebody can't able to join the session, and no worries about that because the recording of this session will be shared from tomorrow. Okay, if there is no questions, we can move forward, Dr. Aditya.
Once again, thank you to everyone for your participation and curiosity. Let's continue to share what we have learned today and help build a healthier, more informed community. I would now like to invite Dr. Vijit to deliver the closing remarks. On to you, sir.
Thank you, Dr. Aditya. So thank you all our speakers for the valuable sessions and to our participants. So before we conclude, let us revisit today's key takeaways. So recognize stroke early, be fast, reach hospital within the golden hour, start rehabilitation early and integrate Ayurveda for complete healing, manage blood pressure, diabetes and stress to prevent recurrence. So stroke is treatable and life after stroke is possible. Thank you. Sarve Santu Niramaya. Namaste.
On behalf of VAMS, I extend my gratitude to Dr. Vichit KV, Dr. Neetu, Dr. Prasad, Mrs. Dilna Sultana, Dr. Aditya, and all attendees. Let's all take a simple pledge today to recognize stroke signs, act fast, and support rehabilitation for anyone in need. Because every minute counts and every life matters. Thank you. Have a nice day.